Welcome back to Ace the AMC. We have another AMC Obs and Gynae recall today, so let's jump straight into it. There's a 29-year-old woman, 5 days postpartum, has a fever of 39 degrees, rigors, suprapubic pain, and foul-smelling vaginal discharge. Her heart rate is 115, blood pressure 100/60, her white cell count is elevated, and CRP is also markedly elevated. This question is asking us what's the next best step in management. So before we go through the options, let's go through the clinical picture. So we've got a young lady presenting after delivery. She's got suprapubic pain, foul-smelling vaginal discharge, which only started occurring postpartum. She's got fevers and rigors, which is suggesting a systemic infection. Our patient is also tachycardic. The blood pressure is normal, but it could be potentially showing early signs of hypertension, really bringing up the red flag of whether this is early sepsis. Her white cell count is also elevated. It's quite normal to see an elevated white cell count, especially in the first 2 days postpartum. However, this usually normalizes within a few days. And right now what we have is a clinical picture of persistent elevated white cell counts, especially since it's been 5 days now. And so this is starting to suggest that we have an infection. So our two main differential diagnoses for such a presentation would be postpartum endometritis, which is infection or inflammation of the endometrium. And it's most likely the case in this scenario, given the whole clinical picture and the foul-smelling vaginal discharge, which is really a key indicator of postpartum endometritis. Our other main differential diagnosis is retained products of conception. And the way we really differentiate between these two diagnoses, because they do present almost identical, is through imaging to see if there is any retained products. That being said, let's move on to the options. What we really need to have in mind is that our biggest concern at this point is sepsis. Okay, so we are already beginning to see early signs of sepsis given the clinical scenario and the picture that we have at hand. So when we're considering our next best step, we need to consider how we can prevent the sepsis, and that would be to give IV broad spectrum antibiotics. So that's what our correct option would be in this scenario. IV broad-spectrum antibiotics is also the first-line management for endometritis, which was one of our differential diagnoses, and also for retained products of conception. Because when we have retained products of conception, we often want to give broad-spectrum antibiotics before we do any sorts of intervention or imaging. So that being said, option B we can rule out because we don't want to do any imaging right now. That's not our main priority. Our main priority is preventing our patient from entering into sepsis. So we rule out B. This can be something that could be done after IV broad spectrum antibiotics if the situation doesn't get any better. C, urgent curettage. This is wrong because in this case, because it's not the next best step. This would be something we would do after we've confirmed the diagnosis of retained products of conception. And regardless, we'd always give IV broad-spectrum antibiotics even before we perform this procedure. Option D, oral antibiotics and review. In this case, this is wrong because this is quite passive given the clinical picture we have of potential early onset of sepsis. So we'd want to give IV broad-spectrum antibiotics as soon as possible instead of this passive approach. And IV fluids only in awake cultures, once again, a bit too passive. We give that broad-spectrum antibiotic before we get the cultures, because regardless in both cases of endometritis or retained products of conception, it's usually a polymicrobial infection, and so we need a very broad spectrum antibiotic. So we give them intravenously to act very rapidly and quickly to prevent that sepsis from occurring. I hope you guys learned a lot from this. I know we went through it quite quickly, a lot of concepts. If you really enjoyed this breakdown, give us a like, give us a follow, and be sure to check out our YouTube channel for more videos like this and more explanations. Feel free to leave a comment or any feedback, and we'll see you guys on the next one. Take care.